As far as the initial talk, it was treatment of symptoms and using medical cannabis to add to whatever regimen you're already on. So there's medical cannabis and cancer. And just in light of the situation, just thought I'd be remiss if I didn't at least address COVID-19 and how that may be affecting you as patients and as well as caregivers too. So I will add a lot of just tips that are out in the public as far as public safety related things and as far as infection and depending on where you are in preventing cancers or on active treatment or anticipating treatment or in your recovery phase with or without symptoms. I just want to at least address something, since that is the big elephant in the room, right? So there will be a little bit of mixture of that and also some tips and depending on where the questions are, if people are more interested on the cannabis and science side versus, what to do at home and what things that they can do to prevent infection in general, then I can just cater to whatever the questions and interests are. So as far as cancer and COVID-19, I think there's a lot of concern as far as where am I going to, where am I going to do, where am I going to be treated? Can I get treated? There's a lot of canceled procedures and treatment delays as far as surgeries go. It's, again, to prevent the surge going into the hospitals because they're now the highest exposures that one might have. And so as far as preventing folks from actually going to the hospital is key in trying to prevent oneself from getting infected. And obviously with cancer population, again, especially if you are on chemotherapy, you're going to be on medications that are immunosuppressive, and that's going to make you more susceptible to infection. As far as medical cannabis goes, again, just because we have this crisis going on outside doesn't mean that what we're dealing with as far as cancer has gone away. So certainly as far as symptomatic care, as far as pain, nausea, appetite. Now we might be seeing more anxiety, insomnia, which is understandable in light of the situation. But this is now on top of what you've been dealing with, which was already an incredibly arduous journey to begin with. So where medical cannabis plays a part, and in conjunction with the medications that you're already on, I'll talk a little bit about that as well. As far as medical cannabis, a lot of the reasons that people take that, again, we're using it for symptomatic relief or palliative care in New York State, and it's effectively used for pain, for sleep, to help relax, to stimulate appetite, for nausea, which is particularly effective. And then there's other things that people have used, not necessarily within the program, but in other states for adult use. That helps with depression and anxiety as well. And one of the things, again, as far as stimulating the appetite, one of the things that we might see in a patient who is going through cancer is having a low body mass index, BMI. And so you want to be able to bolster your immune function as best as possible, try to recruit all those, good cells, and eating, healthily well as best as you can. Some people are unable to because of the treatment that they're undergoing or from the cancer itself. But, the idea is trying to use your natural immunity as well. And then you'll see some other advertisements and marketing where, is cannabis the miracle drug? There's books out there. There's a lot of different avenues where one would forego cancer treatment, chemotherapy, surgery, radiation, what have you, and use this as a sole treatment. I'm not of that, ilk as far as forgoing the conventional treatments. I use cannabis as number one for palliative care, symptomatic care, so for pain, for nausea, to help with the appetite, and especially if those medications that were prescribed have not been effective. So as an adjunct or as a complementary or an integrative therapy rather than as a replacement for cancer treatment. But certainly, again, it's become mainstream, and you'll see cannabis, being talked about in all sorts of different lights, and different states also have their laws as far as what is recreational use, what is adult use, medical cannabis and what is medical use as well. But it definitely has become much more mainstream since when I started a couple of years ago as far as treatment goes. And this is the landscape of where cannabis is legal. So 33 states are currently legal for medical use, including New York, and 11 states are legal for adults over the age of 21. And certainly this is a shifting map, and we'll see how that may change in the future. But again, this has been rapidly been a very dynamic topic for the last 2, 3, 4 years. And again, as far as those who are using recreational use to help with marijuana, and its effect on cancer. So people, there's that that dichotomy of, well, I'm smoking marijuana, which is a smoke, which is not good for cancer, but at the same time, I'm using marijuana to help treat cancer. So where's that divide, and why is that the case? So as far as smoking goes, in New York State, we don't have smoking. So there is no lighting up with fire, combustion, tar, and any of those carcinogens that may derive from that. There is something that's similar. It's an inhaled vapor, and that is often used to help with inflammation in the lungs. And again, as far as studies go, they have not seen a direct correlation with marijuana and lung cancers or head neck cancers, but it's not advisable as far as smoking and using it as a cure for cancer. If it helps with the vapor or other forms that I'll introduce you to, if it helps with pain and nausea, again, there are other forms of administration that's used that are safer. So again, that's what a vapor pen looks like, and you'll see a lot of products that are outside of the state program. And just to be aware, because they are very pretty, great packaging, and they make a lot of claims, but these are all considered in the health and wellness products line. There's over the counter, and they call it medications, hemp oil, CBD oils. I can go into all of that if that's where people have questions, but just be aware as far as false claims and approved products, it's not regulated, and so just be aware of false advertising. The big question is, can cannabis cure cancer? Again, as far as the studies go, there hasn't been any human studies, but as far as experimental models, rat models, mouse models, the three big ways that it's looked at is for apoptosis, which is cell suicide, cell death, anti-angiogenesis, which means that it doesn't spread through the blood vessels, and then anti-metastases, which is going to further sites in the body. So those are the ways that people are looking at the components or the cannabinoids of the cannabis plant. Again, not in any human studies, so people are saying, well, if it doesn't hurt, why not try? So in New York State, again, the certification is not to cure cancer as a replacement for cancer treatment, but to help with the symptoms of cancer itself, as far as appetite, nausea, pain, or even treating the symptoms of chemotherapy as far as adverse reactions, such as nausea, and even, sometimes people have neuropathy, which is, and they develop pins and needles in their fingers and toes. And so that could be also a very effective way to use cannabis. So what is cannabis? So cannabis is a plant. It's a flowering plant. There's different types, what you might hear, strains or varieties, sativa and indicas, and it's made of a whole host of compounds. And specific to the cannabis plant is the major cannabinoids, which are called THC and CBD. And I'll explain what those two are. And as a physician, what I do is leverage the beneficial components of the cannabis plant to be more specific to the individual. So some people may need something that is a higher CBD dosage, and some people may need something that is in a higher THC ratio, and there's combinations of that along with the forms of administration that we can use to customize and individualize the medication treatment to the patient. So again, I mean, there's a number of medications that are derived from plants. Aspirin, for one, is made from the willow bark. That's used for fever and pain. There's certain medications like vincristine, which is used for leukemia, vinblastine, which is used for Hodgkin's disease, and these are all chemotherapy. So there's a lot of medicine and medications, and then it's really distilling it down to be more specific. And if you really think about it, as far as opioids and pain control, I mean, that was originally from the poppy seed. So having plant medicine is nothing new in medicine, but how to use it effectively is the next piece. So again, what makes up the cannabis plant cannabinoids are the two major ones, THC and CBD, but there are a whole host of also other parts of the cannabis plant. The major ones, again, THC and CBD, but again, there's minor cannabinoids and there's terpenes. And, you know, I mean, if you look at some of these things like omega-3 fatty acids, I mean, that's also part of the fatty acid component of the plant itself. So if you think about, say, an orange, and, you know, the main thing that we always think about as far as treatment goes is, or for scurvy and for vitamins, is vitamin C and part of the orange. And then you can certainly go to the health store and buy vitamin C, or you can just, you know, eat an orange. And so it also has fiber, it has citrus, it has a lot of other great components. And so this is what we're talking about when we talk about the natural plant, is not just, you know, picking out and plucking out the main components of it, which we can use to and leverage to our advantage, but also to look at the entire plant itself, because there's other components that are also helpful. So again, brief one slide history of cannabis. This is going back to over 3,000 years BC. The Chinese Emperor Fuxi used hemp as a medication. Again, plant medicine, you didn't really have medications that you got at the pharmacies, and we used plants as a way for healing purposes. It was used in ancient China. It was used in the Middle East, in India, and then it traveled over to Europe and to the States as well. So there's a long history of cannabis use as medicine. And just as far as, you know, still now, as far as complementary therapies using Chinese medicine principles, it's using, again, food to challenge medicines. I mean, that's how I think about it as far as the prevention key, rather than waiting for the disease to come up and then now working on the other end for treatments, interventions, where that's, you know, where a lot of the focus is these days. But again, as trying to promote good, healthy eating and preventing inflammation, so that you don't get to the point where now you're diagnosed, which is usually way later than when symptoms usually present, and then now you're talking about catching up. So the power of cannabinoids as medicine, again, the different combinations in different doses can treat a whole host of these ailments. And the question is why? What is this? Some kind of snake oil or elixir? How is this a miracle drug, and how does it have so many effects other than, you know, people just claiming it to be so? So is it real medicine, right? So there are studies that have been done. This is going back a couple of years ago, as far as taking good review systems, review articles, and looking at the science behind that. And as a compilation, cannabis has been useful for particularly three things, but we're seeing as time goes on that it's anecdotally also useful for other ailments as well. So, but specifically for cancer, chemotherapy-induced nausea and vomiting, chronic pain, and multiple sclerosis, which is also part of the New York program as far as qualifying conditions. And the science behind that, again, how does it have so many far-reaching effects? And this is a professor in Israel, Dr. Raphael Mechoulam, who I had the pleasure of meeting a couple of years ago, who 40, 50 years ago discovered the actual structure of cannabinoids, as well as the system itself. So this is something that's part of our bodies. We have a natural system, just as you would have a pulmonary system, a GI system, cardiac system. This is an endocannabinoid system that we naturally have, and we have receptors that are sort of the ports for what we make our endocannabinoids. The two main endocannabinoids are anandamide and 2-AG. So those are the, I guess you can see, those are the cannabinoids that we make naturally. It's even found in mother's breast milk. And we have the receptor. So those receptors are in our body that receive the endocannabinoids itself. And then there's a whole host of enzymes that, regulate, they, upregulate and also metabolize the cannabinoids itself. So there's an entire homeostatic system within this. And this is what I was mentioning before, that we make endocannabinoids naturally, and that's called anandamide. We have the receptors, and then we have the system that's involved in regulation. And these receptors are throughout the entire body. So mostly in the brain, but throughout the nervous system, but on multiple organs as well. And it serves as an immunomodulatory system, meaning that it's on immune functions. It works on, again, mostly in the brain and nervous system. And these are sort of the keys to the receptors in our bodies. And so why do we have this? Did nature make us to want to be happy? And the answer is yes. So what endocannabinoids do is to help with relaxing. So relax, eat, sleep, forget, and protect. So that in a nutshell. I mean, it's if you imagine, the panic right now of even walking outside the door, we don't want to remember those, again, I went to the grocery store the other day, and it could be a little bit anxiety provoking, but I don't want to have that memory with me for the rest of my life. And so, the body, with sleep, that's another way that we sort of downregulate and extinguish memories, but it's helping to help to sort of calm the system down. And we talked about a little bit of endocannabinoid that we make naturally, and then there's also synthetic cannabinoids, which is actually prescribed. So Marinol, for example, is a type of medication that's used in the cancer world as far as increasing your appetite. So, what's Marinol versus THC? So Marinol is derived from the THC, and it's synthesized. It's not the natural plant, but it's made in a lab. The problem with that being prescribed to cancer patients, they often report that they get very high, they don't tolerate it very well, and it doesn't have the entirety, the wholeness of the plant itself. And that's what I had mentioned about too, that you can pluck out the THC or even make it into a lab, but you want the rest of the good components too. By plucking it out, you're devoiding it of the other components that may have a synergistic effect to it. And so what cannabis, medical cannabis, that is in the program, in the medical marijuana program, are the plants that are very similar to the ones that we make in our own body. So they're not called anandamide or 2-AG, but they're called THC, CBD. These are acronyms for cannabidiol and CBN. There's a number of them, and they still sit on the same receptors. So, anandamide is the brain's chemical of it, and the equivalent would be the phyto, meaning plant cannabinoid, which is from the plant itself, and it goes through the same receptors that's of our bodies. So again, it's going back to symptoms. Cannabis has been used effectively for cancer-associated pain, and also really to bottom line to avoid using the strong opioids. Again, the reason why opioids are so toxic is because there's a level by which one can overdose. Now, if you're a opioid naive versus opioid tolerant patient, then that using high doses of opioids, if you're an opioid tolerant patient, is going to be very different than if you started it for a long time. But the issue here is that opioids over time can increase your tolerance level. It's addictive. It causes a lot of side effects. like such as constipation, and it makes you feel drowsy. And you don't see that in cannabis. So this is opioid-related deaths in Colorado, where cannabis has been used to lower the doses of overall of opioids, or even as an adjunct. There's an opioid epidemic, which is still ongoing, and and just because the attention right now is on the COVID infection, it doesn't mean that the opioid epidemic has gone away. And if anything, I'm concerned as far as addictions and opioids and alcohol use, we see that in closed areas. And the reason why the opioid receptors, where you can have overdosing occurs versus the cannabinoid receptors. Again, it's throughout the brain, but there's an area called the Priebotnitzer complex for those doctors out there. So this is the part where it causes, in the brainstem, where it causes respiratory depression. And that's, you'll find receptors in the opioid receptors in this area, whereas in the cannabinoid receptors, you don't find any in that area. So, as far as overdosing per se, as far as lethal, limits, you don't have that kind of limit that you would have in opioids. So it's not physically addictive in that sense. So let's talk a little bit about the New York Medical Marijuana Program. So, New York State with a population of almost 20 million, it's not as simple as just writing a prescription and giving you a pill. It's a little bit more entailed than that, and I'll go through that. And if people have questions at the end, I can speak a little bit more to that. So the qualifying conditions, there's a list of 13, including PTSD and opioid replacement, which were added in the last couple of years, but 1 through 10 when I had first started. Number 1, cancer. There was IBDs, Parkinson's, but for the purpose of this talk, just highlighting that cancer has been always on the list of qualifying conditions, and associated symptoms being for symptomatic relief. So severe chronic pain, severe nausea, cachexia, wasting, which is the appetite stimulation, and then those with GBMs, like brain cancers, where seizures or spasms may occur. I mean, that may be something that could also be symptoms that would qualify you as well. And this is what I write out as far as prescriptions go. So I focus on the THC, the CBD ratios, whether it's going to be higher on the CBD side, higher on the THC side. If one has difficulty with nausea and appetite, I tend to, or even sleep, then I'll tend to move a little bit closer to the THC side. If someone has difficulty with neuropathic pain, nerve pain, or muscle spasms, then maybe something closer on the CBD side, or even inflammatory pain. So there's different kinds of pain, different natures of it. And really, is it, pain that is acute because you just had surgery, or is it something that has been, more that tingling and discomfort, or is it any mixture of things? So sometimes I'll utilize the different parts of the cannabinoids as far as choosing something that is more high in CBD or higher in THC, or even a combination of both. So as far as the program goes, a year ago, there were about 2,200 doctors. Now there's about 2,800 registered practitioners. And then, and as of about a week ago, there were over 100,000 certified patients. So again, number of cancer registry, there's a whole number more of those who have cancer, but this is where we are for all diagnoses in the state. And the process is this. So you would get evaluated by a physician. If you don't know anyone, there's also a list on the New York State government website as far as a list of practitioners, but I'm also available if you're in New York. So get evaluated, and really try to figure out what might be the most useful for you. I give you a certification, which you can do online, so that you can receive a temporary card that will come first, and then the hard card will come in the mail. So this is for New York State residents only. You have to show either if you have a driver's license or you have proof of address, but it cannot be a PO box. And now, as far as purchasing, it used to be that you would go to the dispensary. It's not at every pharmacy, but there are medical dispensaries throughout the city or state. And you would talk to the pharmacist there and, see what the products in hand would look like. And they would, you can make your purchase, and then we would discuss, as far as monitoring goes, what worked, what didn't work, any problems, and the different forms that are available. Again, there's no smoking form, meaning that there's nothing like a cigarette that you would have to burn or light up. There's also no edibles, meaning there's no brownies and gummies that you would be able to take. And I'll show you what the forms that they have available. So capsules, tablets, oils, vapor form, other forms. So this is what oil may look like. This is a vapor pen. Again, it's preheated, so it regulates to the correct temperature. And then it's almost like Vicks, where you take a deep breath, and it's medicated oil. So that's how one would take the vapor form. But again, there's pills, capsules, lozenges, powders where you can put into a tea. Oils, I think, are very effective, especially for someone who's just started, as far as putting it under the tongue. And then for those who have mild pain, say they have joint pain, for example, and they don't want to take anything systemically, then they also have lotions and transdermal patches available. And this is what a dispensary looks like. Again, these are some of the products that are there, and this is what the inside of what an example of it inside of a dispensary looks like. And now, as far as what's going on, bringing it back to April 2020, is that you're not going to be going to the dispensary, as far as moving out of your house. So they do have telemedicine now. So I have telemedicine services as well, as far as certifications. The medical dispensaries too. If you to set up an appointment with the pharmacist, you can talk to them virtually as well. And they also have online ordering and delivery, so that can be done by phone or online, and then it will be delivered directly to you. And there's a list of those registered organizations, which I can also show you if you have my screen up as well. So just going back to the COVID prevention, again, prevention against infection. So whether it's COVID, whether it is, pneumonia, bacteria, anything, the whole idea is to prevent infection altogether. So just some tips. Again, you've heard the social distancing, you've heard about, having the 6 feet apart, even wearing a mask, but just other things that one might keep in mind is, for shopping, having one person to go so you're not exposing a family or more than one person. Having a place near the, near the front door. So if you don't have a garage, again, I live in Manhattan, in a small space. So, but I do have an area where I have my shoes and, where I take off things that are now exposed to the outside. Covering your coughs and sneezes, which which has been in the media a lot. And then also, it's not just, say I even have virus on my, on my hands, it's still a port of entry for it to go from my hands to my face. So washing my hands in the house when I've already deemed this, area, clean or safe or sterile, not sterile, but, but a clean space. Is why when you enter the room or coming from outside to inside, wash your hands, but walking throughout my apartment, I'm not washing my hands, the entire time, unless I'm preparing food. And then there was a whole idea of, should I wear the masks? Now, for if you are immunocompromised, you're undergoing chemotherapy, again, I think just a general rule, having a mask when you're outside is prudent. Covering your mouth, covering your nose. Again, if it's not a mask, then a face covering that would be appropriate. Again, we don't know, we don't know what was in the space before, but I think there's also a lot of confusion as far as what is airborne versus what is aerosolized, and what's the big deal with N95s and face coverings and regular surgical masks. And this is considered, COVID is considered aerosolized, meaning droplet or moisture. So if you sneeze on someone, if you cough on someone, or you're talking closely with someone, that is droplet forms, versus airborne, which is something like, tuberculosis, where you would actually need a negative pressure room, which we're not, which is not the case here. It's close contact and distancing. So, breathing fresh air in the park, fine. But if you are in a enclosed area, like say a subway or bus or grocery store or pharmacy or hardware store, then best to put on the mask, because again, as many barriers you have between you and and those who might be shedding, and they may be asymptomatic and they may not look sick at all, but we don't know at this point. And the caution is also doffing. So doffing means taking off, donning and doffing, taking on and taking off. I can also show you an example of mask of how to do that, or taking off gloves if that's something people would be interested in, because if you have the face covering on the outside, everything on the outside is now exposed and everything on the inside is considered safe. But if you take it off, you want to make sure that you're not touching now the outside and contaminating, touching your face with it not being properly doffed. And just being aware of your space. So, as far as disinfecting things that come from outside, deliveries and mail, again, the idea is not just person to person as far as droplet transmission, but also the fact that you can possibly get contact transmission too. So things that might be sitting on, paper or metal rails and things like that, that it might be sitting there for a little bit. And what I do is, I'm not wiping everything down, but what I do is I, bring in the mail with gloves, and then I just put it by the window and, just let it sit for 24 hours. And then I'll look at the mail a little bit later. So if it can sit, again, if you have a garage, then you can have it sit there. But if not, then I just bring it to the window and let it air out a little bit. Again, washing your hands before coming into the inside. And then also just, things that may not be so obvious, but removing your rings so that you can properly wash your hands in between the fingers, under the nails and the rings itself. So again, the best way to prevent illness is to avoid being exposed altogether and staying at home. So, if you're going to be inside the box, then think outside the box of all the things, all the innovative things and all the fun things that you can do. There's a lot of communication, and the fact that we're even able to do this, there's a structure there, there's some limitations there, but at the same time, it's also, I guess, a different kind of experience. And I'm welcoming all those who have joined us who normally wouldn't have come. So practicing social distancing, and, as far as what I think about social distancing is more about, again, thinking about your space. So your physical space is here and the next one is over there, inside and outside, but it doesn't mean that you can't be connecting electronically through portals like this. Again, this is now going that next step of not just simply a mask or staying away, but again, looking at jewelry, taking those off, keeping your nails short, bringing a change of clothes, keeping your hair tied back, glasses. I'm wearing my glasses, and actually I have a pair that have a bigger frame that I'm going to see patients with. If I have to see patients, that covers more of my face. And then again, I'm putting, when I come indoors, I disinfect it and put it by the bay window. Other things are, keeping your shoes at the door, and maybe having a change of clothes and having sort of a bag that is exposed versus, those that are clean and showering. And then as far as just, bolstering your natural immunity, eating foods that are healthy, fruits, vegetables, fiber, grains, lentils are all really good healthy fats. And, the idea behind, culinary medicine, which is how I incorporate medical cannabis with nephrology, talking about diabetes and hypertension and kidney disease, is trying to get to the point where they don't have to see me as a nephrologist, that they can work on, or patients can work on, lowering the salt content or lowering the sugar content, or, incorporating exercise or good foods in one's diet to try to prevent from having to see me as a kidney doctor, where a lot of these diseases are preventable. And then just as an aside, for things that, again, nothing that is controlled, trial, tested, anecdotal, but just what makes sense as far as infection is drinking warm fluids, keeping yourself hydrated. That's assuming that you don't have kidney disease and heart failure, and eating foods that are natural. If you can pronounce what you're eating, you know, a peach is a peach, a banana is a banana, but a lot of times you'll see things on packaging where I don't know what that chemical is. So why would I be putting that in my body as far as, you know, good nutrition and nourishment? Again, going from outside to inside, you know, the virus tends to be in the nasopharyngeal passages, and then it goes into your lungs. It's a respiratory illness. So, you know, if one wants to try to gargle with salt rinses or even do some nasal irrigation. But I think as far as, you know, moving around and doing breathing exercises, taking deep breaths in, taking deep breaths out, you know, again, getting the airflow through your lungs. And then throughout the day, you know, taking moments to take a break and just, you know, have your feet grounded on the earth and say, okay, gravity is still here, the sun is still out there, you know, I am able to breathe in my home, and, you know, just be aware of where we are. And then this is a little bit blurry, but what cancer cannot do. So, you know, can't cripple love, shatter hope, corrode faith. It cannot destroy peace, kill friendship. It cannot suppress memories. It cannot silence courage. It cannot invade the soul. It cannot steal eternal life. It cannot conquer the spirit. And same thing with this infection. A lot of things that these things can't invade. So maybe as far as going out, you know, maybe that's a different space that we now have to negotiate. But, you know, as far as mental wellness and awareness and letting an infection and fear invade our personal space, our emotional space, physical, you know, spiritual space. I mean, these are all things that we can sort of compartmentalize and help. With that, I appreciate you spending the time. And if you have any questions, I can talk about COVID infection. I can show demonstrations of how to take off gloves. So I'll just go where people are most interested in as far as topics go. As far as gloves go, you don't have to have gloves like, you know, latex gloves too. I mean, anything like a bag can be used, piece of paper, it's any kind of barrier, really. So sometimes I've even gone out the building and I have, you know, a newspaper or magazine that I've cut up, you know, have ripped out, and then I'm using the paper itself to open and close doors, and then I'm sort of sparing my gloves that I don't have a ton of. But what you want to do is, if you do have gloves, is that, imagine again the whole wet paint situation, is that you don't want to get that wet paint onto your skin. So what you want to do is, with one glove, is sort of pinch it here, and you want to take off the fingertips and sort of pull it off without using this now outside dirty hand inside the glove. So this one gets pulled in. I haven't touched anything on the outside. I'm grabbing it, and now this hand is clean. And what I want to do is take the inside of the glove. So now again, everything on the outside is exposed. I take the inside of the glove and then I wrap it up. So now it becomes a ball. And everything on the inside, now that it's flipped out, is free to go. So this is, you know, again, if you want to toss it into a trash can. But again, I mean, I've even laid that out into the window, let it sit for 24, 48 hours, and then I've reused it again. And also, after you've done that, wash your hands. So, you know, so that's the whole idea of doffing gloves appropriately without exposing yourself, because I'll see masks that are kind of halfway off and then on and then off and then on, and then, I mean, that's, you know, that's the issue as far as, you know, touching your face and touching surfaces that are now exposed versus the cleaner surfaces which are on the inside. So you want to turn those things inside out. As far as face masks go, so again, it could be a face covering. You just want to make sure that the more weave or thread count you want to say, the thicker it is, where you're not seeing. So for example, this is a little bit translucent, so you might not be able to, this might not be so helpful as far as having a scarf, but something that has multiple layers and you want those cross layers in there. That's just for a face covering. If you want to put something below it, you know, no one says that you only have to wear one mask. I mean, sometimes I'll have one mask to put on, and then a second one just to protect the one underneath it. So one remains, one is clean and the other one I can remove and toss, or what I'll do is I'll reuse it and I'll leave it out and then I'll rotate it. But as far as putting it on, it's fairly, straightforward, is just to put it on. But what the mistakes that I see a lot of times is that it's not up against the face. So so what you want to do is you want to make sure that that the mask is hugging and making it as good of a seal around your face. I know it's a little bit uncomfortable. I've also seen people who who are putting the mask below their nose, and that doesn't make a whole lot of sense. So you want to press against the nose, you want to press against the face, and then you want to put it, again, I usually put my hair up, and I don't have any earrings, but I put my face up because I realize, again, this is a process for me as well, is that when I put on the stethoscope, then I had difficulty with the ears coming off and my hair. And so this took a little bit of trial and error too, but it can be done. So again, you want to make sure that the nose piece is there. You want to press down firmly across the the cheekbone. And then if you are wearing glasses, you want it on top of it, not below, because now you're exposing it. And then as far as taking it off, again, if I've gone outside now, just assume that everything here has, if you imagine wet paint, you don't want to touch the wet paint. So what you want to do is now you want to take it from the ears and you want to take it off, and you want to make sure that you're not breathing anything or touching anything now on the surface of the mask. And then you can go and hang it up, or you can discard it, or use it for later use. But now this outside is considered exposed and the inside is clean, but you want to put it away. And or what you can do is you can take it from the inside, because everything on the inside is clean, and you can try to dispose it that way. That would be on the adult side. That's something that you'd see on the right, on the over the counter, rather than something that I would necessarily prescribe for. So that is the CBD gummies. It does not have any THC in it, and the whole idea of why it's important to have just a little bit of THC along with the CBD is that, again, it helps. There's a synergistic effect called the entourage effect, as far as CBD sort of helping the THC take effect, to be a little bit stronger, and vice versa. So it's a little bit, kind of going hand in hand. So CBD gummies, again, I would just be very cautious as far as things that are not regulated. That being said, if you know the company and the practices of it, it has a QR code, it has a lot number and expiration number, just as you would, again, especially with cancer patients, the concern is that you're already immunocompromised. And if you are taking something that's unregulated, you could potentially, again, if it's derived from a plant, there's fertilizer, pesticides, there's, could be heavy metals and toxins in it. And so you just have to be very careful that you're not now introducing, say fungi to something that, when your state is already in an immunocompromised state. So you could be actually adding, not necessarily COVID related, but as far as fungi and other, microbes that are on that plant that you're now derived from. So as far as CBD gummies go, as far as the safety of it and the potency of it, I don't, I wouldn't recommend it, bottom line. So depending on who the prescriber is, they can write for up to a year. If again, it depends on the practitioner, because sometimes they can waive that renewal, the annual renewal part, and that's often what I will do is I will not necessarily put a limit on the card itself so that you don't have to keep on re-registering with the state, but I will monitor the length of the prescription, so that I might be seeing you every 3 months or every month, depending on what the situation is. But in general, I think most people will give you a year for the card, and then as far as renewing, you'll talk to that person again, or somebody else, and they will give you a new recertification number. Everything is already pre-populated, and you just have to re-enroll, and then it just continues. So it's okay if there's a lapse there. There's ways to get around it and navigate around it, but the the process would be to, see whoever prescriber is, and then just get re-enrolled. And you would, if you've already gone through the first time of participating in the first place, the second time around is much easier. Everything is already sort of, click through. So I wouldn't think that it's additive in that sense, but if you, being a transplant patient, you're already immunocompromised because you're already on immunosuppressants. So you might be on cyclosporin, you might be on tacrolimus, mycophenolate. There are, as far as adding the medical cannabis piece, you have to be just careful as far as increasing the potency. You have to take a blood draw to make sure that you're within the certain levels. But as far as, I wouldn't say that your risk factor has now become twofold versus being being just another hit on top of it. But you would be a high risk patient as far as susceptibility. I wouldn't say it's twice as much, but either way, I would say to be as cautious as possible, especially if you are a renal transplant patient. As far as the cancer goes, if it's in remission or you're on chemotherapy, I don't know where in the process you're in. If you've been in remission and haven't had any issues related to that, then I wouldn't say that you are actively immunosuppressed. I would be more concerned of the cancer, the kidney transplant, because you are taking medications for immunosuppressants. So a lot of those medications are very similar, like say chemotherapy medications, where it decreases your immune function. One is to have a license, so you have to have residence or proof of residence. So if it's a New York State ID, then that'll be fine. And if you are not from New York State, as long as you have an address, so if you have a utility bill or if you have a copy of a lease, as long as it's an address that a card could be mailed to, they just want to make sure that you're a New York State resident. As far as cancer diagnoses, a lot of time I'll ask for a pathology report, but as far as now I get referrals enough that, or I'll call the office and say, can you just send me the last medical note? Because it's less of a concern as far as my prescribing, as far as who is a cancer patient. If it's something where it's a little bit less concrete, then sometimes I'll talk to the physician and just discuss what the situation is. But for the most part, really being a New York State resident, and then the documentation of one of those diagnoses, so whether it's cancer, neuropathy, chronic pain, opioid replacement. So I've even, with that diagnosis, for example, I've had patients who were planning on undergoing surgery, and again, nothing cancer related, but afterwards it's going to be expected that they probably will be on some kind of painkiller. And so as something to replace opioid use, they've come and used cannabis itself as a replacement. So but really it's those qualifying conditions that one has to adhere to. Right. So so as far as the cannabis products at the medical dispensaries, that is currently not covered by insurance at all. I can give you where those websites are. You can take a look at the cost, but it goes, I've seen products where it's, maybe $25, $80, but I would say out of pocket, likely closer to $80 to $200 a month. As far as medical visits, I've seen where I've given the invoice to patients and they've submitted to their insurance companies and there has been partial coverage. Medicare, Medicaid definitely will not, because those are federal programs. So again, state by state, depending on where you live, cannabis is legal, but as far as the legality of it on the federal level, it's still considered illegal, unlawful. So things like banking, credit cards, it's for the purchase of cannabis is disallowed. Yeah, no, I mean, that one's a tricky one as far as the state laws in North Carolina. So in New York State, certainly PTSD is a qualifying condition. In North Carolina, if adult or recreational use is not allowed and medical use is not allowed, then I would say, again, it's awful to say, but it's really then talking to your politician. As far as the medical cannabis goes, I wouldn't say to get things kind of crossing state lines and that sort of thing, because you don't know what the quality of that is, and I certainly don't want to have you do things that you would be uncomfortable with, because crossing state lines is an issue. So say, for example, a neighboring state, say, for example, in New York, Massachusetts is a neighboring state that does have recreational use. By going from that state to this state, that's disallowed. As far as, how much emphasis is, regulations and what people are looking at as far as traveling to other states or even internationally, it's more relaxed than it had been in the past. But that being said, it's still, fundamentally a law change rather than something on the medical side. I would suggest to try to do this instead of that. For PTSD, I mean, again, I try to, cannabis is one sort of prong to whole treatment. I've also talked to PTSD patients, particularly from the 9/11, who are now coming in with not only PTSD but also with cancers, and besides cannabis, I think, being very effective, but behavioral therapy, psychotherapy, talking to someone, EMDR, which is eye movement desensitization and reprocessing, is a technique that I think is very effective for those who have PTSD, as far as sort of thinking about how to, think about it mentally in a different way. So again, I really do see the use of medical cannabis, but I don't think it's a one-trick pony. I think there's a lot of things that can be used in addition to the use of that. And so if I can use cannabis as a way to help with, PTSD, while they're still working on the long-term parts with their therapist, and eventually not be on the cannabis at all, then I think that would be fantastic. It depends on which form you're using, as far as, are you inhaling, or inhaled vapor form, the sublingual capsule form. There is a component of, again, as I mentioned, the CBD particularly is a non-inflammatory benefit that it has, very similar to Motrin, Advil, those NSAIDs that are used, which is also anti-inflammatory as far as how it works in our system. And there was some discussion of whether NSAIDs can be used in light of the COVID illness, or instead of as far as the inflammatory process, because as far as how COVID, the history is it's used, if someone has developed mild symptoms, it's usually around the 7-day mark, maybe 5 to 10 days, but usually mild symptoms for about a week. And then it's really at the 7-day mark where either people, recover, and they recover, completely, or the concern is, who are the ones who might, crash and decompensate. And NSAIDs have been used, or was thought to be used, to help with the inflammatory response, because that response is so quick because it's overreactivity of the inflammatory system. So it's called a cytokine storm, where your body is working to produce fever, which is normal, to elicit all those inflammatory cells, which is normal to fight off infection. But when it gets to be overwhelming, then it almost goes into overdrive. And that's where people sort of go downhill very quickly. So that's why they looked at NSAIDs as a non-inflammatory way to sort of quiet down the body. Whether CBD may have a similar role as far as the inflammatory process, I wouldn't say you would need to stop it. But as far as whether it would help treat or cure COVID, I wouldn't go as far as that either. Both, either. I think more physicians are aware that patients are interested in this, and whether they themselves may prescribe or they might refer you to someone else, or a lot of times they will refer to me, is a discussion that you should have. If I've seen a lot of patients who are also on clinical trials, and it has not interfered with any of those studies at all. So for the most part, I would say that physicians have been happy to know that there is an alternative or something else that one may try to use instead of using, say, the typical pharmaceuticals for symptomatic care. And not as a replacement for, say, chemotherapy or conventional treatments. I would still say, do what is suggested as far as conventional treatment and modalities, and then adding the cannabis as an adjunct for symptoms rather than primary treatment. But you can talk to either one of them, and see what they say. And you'd be surprised. Some people may not have all the a lot of the armed with the education that you now have as far as how it works. But there's certainly a lot of patients who are doing this, with or without the knowledge of their doctors. But I would say, being transparent as I am too. So whenever I see a patient, I always ask, would you like me to discuss this, or at least send a consultation letter over to your doctor, so that they know that this is part of your medication record and not something that you're doing behind closed doors. So there isn't the bong form in New York State. So as far as different forms of administration, whether it's a vapor, again, it looks like a pen that's heated, and you inhale the medication. So it's medicated vapor. There's also oils that you put under the tongue, or even spray on the side of the mouth, the cheek, and you leave that. Or then there's capsules and tinctures and tablets. So depending on, again, in New York State, we go by the ratios as far as high THC, high CBD, mixtures of both. But the other element is how you're taking it, as far as the form of how it's absorbed and how long it lasts. So a vapor form, which you inhale, is going to have a quicker onset, meaning it's going to be the medication is going to be immediately released. So if you have pain right away, and you want something to quickly curb it, then I think inhaled, or panic attacks or something, then inhaled form can be very effective. On the other hand, capsules and tablets, which you would swallow and wait for it to go through your digestive system, takes maybe an hour and a half. Again, everyone has their curve of how quickly it takes effect and how long it lasts. But typically, capsules and tablets tend to stay longer in the system. And sometimes we leverage a combination of both. And sublingual is somewhere in between as far as drops go, where it's sort of intermediately takes effect maybe 15-30 minutes, and it lasts for maybe 2 to 4 hours. So for example, those who have difficulty sleeping, I often ask whether it's falling asleep that's the issue, or staying asleep. Because if it's falling asleep, then I would say something like a sublingual may be more effective, even a vapor form, if you want something that will, that will just do the trick, but it will last, for a shorter amount of time. And then if it's more staying asleep and the maintenance and duration that you're looking for, then something that's longer acting, so maybe sublingual to a capsule might be more effective. So, sometimes we get creative as far as finding the right combination, but in general, different forms of administration do confer different half-lives as far as how quickly you want something to act and how long you want it to last for.